Yeah, so as mentioned, I'm an investigator with the Regenstrief Institute here on the campus of Indiana University. I'm also a faculty member in the Department of Health Policy and Management at the Indiana University Richard M. Fairbanks School of Public Health. I'm a health services researcher by training, very much interested in the intersection of policy, public health, population health, and technology. Yeah, when you think about public health, I think something that's come to everybody's attention throughout this pandemic is that there is multiple levels of policy in the US that local jurisdictions, cities, counties are working to improve public health. We see stuff occurring at the state level as well. And of course, the federal government is also involved in public health policy in a variety of ways. And what we were looking at really was in this study, what has been the influence and kind of the interplay among all of these different levels? And what we found is, public health, the people who are close on the ground in the local area, policy seems to be fairly influential in improving public health adherence to guidelines. Sure. So when the pandemic started, we actually had very little opportunity to control and protect people's health, right? If we think back to when the early it was kind of this social distancing. We had a lot of, whether we called it hunkering down or, kind of going into lockdown, depending on whatever phrase you want to use. We had kind of social isolation and distancing. The other option we had was masks. That was really it. This is before we had any effective therapies, well before any vaccine. And so we started looking at mask behavior in public, cheap, easy to implement, very effective in protecting people. And what we did is, over a course of multiple months, we had a team of students, research students from our school, go out and do observations. They went to public places, retail shops, malls, public transport places, places of government like libraries, those sorts of things. And they had an app, and they just would count the number of people they saw wearing masks, whether they were wearing them correctly, incorrectly, or not at all. And we tracked that over time to understand what was going on. And then what we did is also checked for policy changes going on at the same time to see how that affected mask wearing behavior. So what we found during our period of time was looking at individuals who we assumed were about 2 years and older, because that's what the guidelines were. We saw about 85% of the populace would wear masks in public. And so we went from a shift from where masking was very, not a common activity or not a normal behavior in the US, to something that was just widespread and accepted across for multiple months. Mask wearing in public places was the norm. That's what just most people did. And during this entire time, we did have a requirement to wear a mask in Marion County in Indianapolis, and that was in effect the entire time. But what did change was the state. The state had one on, and then they turned theirs off and no longer required it. When the state turned theirs off, we saw no change. Masking stayed the same at the local level. We had, during the same period of time, a change in federal administration, which also issued in suggestions for masking and requirements in certain locations for masking. That actually didn't have any effect either. The local policy still seemed to be the one driving consistent behavior. The one change we did see is towards the end of our study, the Centers for Disease Control announced that individuals who were vaccinated did not have to wear masks in public. And as soon as that announcement came out, we did see a significant drop in masking in public. It still was the majority of behavior. It still was the norm, but that is the one federal change that did seem to have a local impact during this period. So I think the first key takeaway is the influence and importance of local public health policy and decision-making. We have local public health who is able to work with the community, to have the closest messaging with their community, to be the ones to work with the business community to help do those reinforcing behaviors that were really important for everyone, like having signage and a greeter at the door wearing a mask or giving away free masks, that sort of thing. That's really something that locals can do very strongly. And that's the ones I think really reinforces the need to have strong local public health activities. I think the other thing that comes into the play in this study is the Centers for Disease Control still is a widely respected and fairly influential body within our public health system and government. So when their recommendations come out, it does seem to have some influence and people pay attention to that. So that is another point where making sure that local, state, and federal are in alignment is probably in everybody's best interest. Regarding masking and public health behavior, the other thing that we were able to do during this time that people may be interested in, Indianapolis and the state of Indiana, if you didn't know, hosted the NCAA men's basketball tournament. And we did an additional study where we were able to go and replicate that activity at the basketball games. And actually we're doing mass counting among mass spectators and in this mass event. That research is recently published, and we're having hopefully more come out on that. But that's just another space where as we're opening back up and people are getting to bigger and bigger crowds, and some places still have masking suggestions or requirements. It's influential to know, and interesting to know how people in groups kind of respond and behave in these larger kind of very, exciting and high energy venues. A little different than going to the grocery store to do your shopping. The last thing I would say is, we, as public health, we definitely encourage people to be safe. Masking was very common and an effective approach, but by far and away, the strongest tool we have in our tool belt always is vaccines. Vaccines are very effective, very safe. And if anybody has any questions or thoughts about vaccines or wonder about their own status, I really encourage them to go talk to their trusted primary care provider to ask them about their opinions and on vaccination.